Hello, I'm Dr. Satyabala, consultant ophthalmologist at Narayan Netralaya, Bangalore. Today I'm going to tell you about a very important aspect in a woman's life, the stage of pregnancy and eye changes that occur during pregnancy. Suddenly during pregnancy you may find that you're wearing glasses but the vision is not as crisp as before. Or you may not even be wearing glasses but the vision is not as good. Suddenly, you may find that one particular eye or maybe both the eyes, the vision is not as good as before. So why does this happen? This happens due to hormonal changes which are very normal during pregnancy. That is to take care of the baby which is growing inside you. But then it causes changes in the eye. So when does this happen? This can happen early during pregnancy or any time in the course of pregnancy due to hormonal changes. So what exactly happens? There is fluid retention during pregnancy, which causes changes in the shape of the cornea. It may become thicker. The fluid which is there in the eye, that's aqueous, may increase in amount. Or the tear film which is there, the composition may change, or the amount of tears which are produced may decrease. So all these things together can cause a change in the vision of a woman during pregnancy. There are some conditions which can occur during pregnancy which is specific to pregnancy. One is preeclampsia. Preeclampsia is when there is hypertension with loss of protein in the urine. And the second condition is gestational diabetes, where there would be no diabetes before pregnancy, but during pregnancy, due to the hormonal changes, you could develop a rise in the blood sugar, and that is gestational diabetes. So in these conditions, there could be some eye-related changes, and we should be aware of that. What are those? One is blurring of vision, as I just said. Second is you may see double vision, or you may see some black spots or flashes of light in front of the eye. You may find you're very sensitive to light. So all these conditions warrant for an immediate eye checkup. And yes, if you have a condition called glaucoma before pregnancy, or you're planning to get pregnant, be sure to meet your eye specialist because your glaucoma medication may need to be changed. Say you are on 3 glaucoma medications, it may happen that the intraocular pressure decreases and the number of eye drops which are given for glaucoma may have to be reduced, which may have to be again increased after delivery of the child. So these are the conditions where you need to seek immediate medical attention. So how do we take care of our eyes during pregnancy? Now the main thing, in fact 65% of the women face is dryness. Dryness because of decreased tear production and change in the composition of tears, which I just said. So for that, what we need to do is, we need to hydrate ourselves well. Drink at least 2 liters of water. Take adequate nutrition in the form of vitamin A, D, E, and omega-3 fatty acid foods in the form of dry fruits and dry fish, fatty fish. We should be having all that. We should take adequate rest. 8 hours of sleep, of course, is very important, but in between also we need to rest. All these things will alleviate the symptoms of dryness. When we go out, see to it that we wear good sun protection sunglasses with 100% UV protection. Most of us use visual devices these days. See to it that we use it to the minimum, and when we are using it, we should be following the 20-20 rule. What is that? Blink more often. Consciously increase your blink rate. Every 20 minutes, look out for 20 seconds, 20 feet away. Keep your screen 20 degrees below your eye level and 20 inches away from your face. That's the 20-20 rule. When you use a mobile, decrease the brightness. Never use a mobile in a dark room. So if you're wearing contact lenses, you may not feel as comfortable as before. That's because of the dryness. So try and use it to the minimum if you have to use it. And maybe you require some hydrating eye drops along with your contact lenses during that time. See to it that you're not exposed to smoke of any kind. First hand, of course, no smoking at all. And never even enter a room where somebody is smoking. So all this can aggravate symptoms of dryness. So as I said, most of these changes are due to temporary phenomena due to hormonal changes, but there are some changes that may continue after pregnancy also. The thing to be taken care of is preeclampsia and gestational diabetes, which I just mentioned. Now, in preeclampsia, whenever your gynecologist finds that the blood pressure is more, there is protein in the urine, she will obviously ask for an eye checkup. And then eye checkup has to be done in every trimester. So in preeclampsia, we need to take adequate bed rest, take antihypertensive medication, and regular follow-up is very important. In gestational diabetes, we need to take care of our diet and exercise well, so that our glucose is utilized and the blood glucose level doesn't rise to a very high level. So pregnancy is a very nice 9 months in a woman's life, but so many changes keep happening. If you notice blurring of vision, be sure to call your doctor, meet your doctor, ophthalmologist, because that could mean something more sinister, something like say preeclampsia or gestational diabetes, which should not be taken lightly, and that can be detrimental to you and the health of your baby. So seek medical attention promptly in these conditions. Thank you.